Our work focuses on traumatic brain injury, and typically severe traumatic brain injury. So when we talk about that, that means you're in a coma, you're in an intensive care unit, you've often had a neurosurgical procedure on your brain, and our work seeks to understand who are those patients that are most likely to deteriorate, and we are trying to understand that at the genomic level. So the idea that we could predict which patient is going to have rapid swelling or increased bleeding in their brain after an injury before it happens is important for civilian trauma care. Obviously, we would be able to allocate resources towards that patient, be in the right type of intensive care unit, potentially earlier operation. But if you think about the battlefield circumstance, you have a couple of opportunities there. One is if we know who that patient is, who's more likely to have that expansion of the bleeding or the swelling in the brain, then that patient would be one that could be put in line for triage out of that theater of operations earlier, or allocated towards specific levels of care within the military system as well. And so being able to take that concept and then translate it into clinical protocols is one of our TRC4 grant awards. And so what we've been doing with that is developing a polygenic risk score, one in which we can derive that in 6 hours after injury, meaning you hit the emergency center. By the time you get to the intensive care unit, we know if you're at risk. I think the critical function, or a critical function of TRC4 is bringing together all of the component institutions of the University of Texas, some of which aren't integrated with a healthcare related institution, or HRI, that's what we call them in the UT system. So you can have a world-class engineering program that can develop biomedical engineering solutions, but they need a constant feedback and interaction with the clinical end user, mainly because the field is moving. And you run the risk of developing a solution that needs a problem. I think that the secret sauce of TRC4 can be providing that venue to where, and the connections, so that the teams that are in the world-class engineering programs don't drift in terms of their focus on a problem or a solution that where the problem is moving, and secondarily, by providing that connection, it reduces the barrier to translating that development, that device, that therapeutic, et cetera, where there's some natural stopping points if you're not integrated with the healthcare related institution. You don't have that baked into your team structure, to where you develop this new device that is related to, let's say, orthopedic limb reconstruction and recovery. And that's great, but at some point you're going to need either a physiatrist or an orthopedist, or both, to work with you to get that to the next level. Now you can go find them somewhere, but when it's organic to your program, then that becomes a easier path, which ultimately shortens the time to delivery, which is what this is about. If you look across the state of Texas, Houston, Dallas, San Antonio, Galveston, in Austin, in these major metropolitan areas where there are all of these highest tier trauma systems, the ability to execute upon complicated clinical trials within one administrative structure is we're able to pull that off, is something that can really accelerate the knowledge that's needed to prove or disprove the utility of whatever that intervention is, so that we can iteratively improve care. And by having it all, it sounds like, well, how hard can that be to get that, kind of under one roof? Well, actually, there's a lot of barriers to doing that, and once that's solved, then the time from concept to data is markedly reduced. And the more you do it, the quicker it becomes. And so then the kind of second and third order benefits for this, if we can keep this sustained, the second and third order benefits are, it becomes a center of gravity that draws in industry, other federal funders who want and see a very highly efficient, effective, functioning ecosystem for trauma research. They want to come and they want to test that within what's a very, very diverse population as well. Well, I need to have the genomic variation of everybody, and it turns out we have that in Texas. We've got this wide genomic representation, so that the data that you get, and the reason it's important is the data that you get are generalizable out into anywhere. It's not just, oh yeah, we have this one little niche population and that may not really be representative of the rest of the United States or world, etc. So we're at an inherent advantage over some of these places if we are able to put that together.